childhood obesity is no longer a future health concern. It is an immediate and long-term public health crisis with implications that stretch decades beyond adolescence. What begins as excessive weight gain in childhood or adolescence is not just a predictor of early diabetes or heart disease, but also a dangerous primer for lifetime cancer risk. Mounting evidence now shows that obesity during developmental years sets in motion a cascade of biological disruptions, some irreversible, that elevate the likelihood of cancer onset earlier in life and increase its aggressiveness once it appears. Despite this, cancer prevention efforts rarely focus on children, allowing a silent but powerful risk to grow unchallenged through the most vulnerable years of life. Excess weight in childhood is not a benign condition that children grow out of. On the contrary, over 80% of obese adolescents become obese adults, carrying forward the metabolic burden of early life fat accumulation. Fat tissue that develops during critical windows of growth, including puberty, is particularly disruptive to long-term hormonal regulation, insulin sensitivity, and immune function, all systems that shape cancer vulnerability over time. The earlier obesity begins, the longer these carcinogenic influences persist. Among the clearest threats posed by pediatric obesity is the disruption of endocrine function during puberty, a critical phase for hormone-sensitive tissues. Early and excessive fat accumulation leads to elevated levels of estrogen, insulin, and insulin-like growth factor 1, IGF-1, all of which are known mitogens that promote abnormal cell growth. In girls, early-onset obesity is strongly associated with early menarche, increased lifetime estrogen exposure, and significantly heightened risk of postmenopausal breast and endometrial cancers. In boys, excess adiposity can lower testosterone, increase estrogen conversion in fat tissue, and potentially contribute to future risk of testicular and colorectal cancers. These hormonal alterations begin before most pediatricians would consider discussing cancer, yet their impact may be irreversible decades later. Obesity also drives systemic inflammation in children, just as it does in adults, but its effects during development may be even more damaging. Pro-inflammatory cytokines such as IL-6, TNF-alpha, and CRP are often elevated in obese youth, contributing to a chronic low-grade inflammatory state. Over time, this not only fosters insulin resistance and metabolic syndrome, but also increases DNA damage and impairs immune surveillance, the body's natural cancer defense mechanisms. The inflammation is silent, but its biological footprint is enduring, embedding vulnerability into tissue systems long before malignancy ever forms. Emerging epidemiological data further reinforce the danger. Childhood and adolescent obesity have been linked to a higher risk of multiple cancers in adulthood, including colorectal, pancreatic, kidney, thyroid, and endometrial cancers. Alarmingly, early life obesity also appears to be driving an increase in early-onset colorectal cancer, a disease once almost entirely confined to older adults, but now rising sharply in people under 50. Studies suggest that obesity and insulin resistance during youth may play a direct role in the accelerated development of these malignancies, often leading to more aggressive subtypes with poorer prognosis. Worse still, cancers that emerge in those who are obese in early life are often harder to treat. Long-standing metabolic dysfunction, altered body composition, and inflammation can make standard therapies less effective, just as in adult obesity-related cancers. Additionally, decades of exposure to excess insulin, lipids, and hormones may lead to more complex tumor microenvironments and greater resistance to chemotherapy or immunotherapy. This means that pediatric obesity doesn't just increase cancer risk, it also increases the chance that cancer will be harder to detect, harder to treat, and more likely to recur. Despite these dangers, pediatric cancer prevention efforts rarely target obesity directly. School nutrition programs often focus on short-term outcomes like BMI reduction, with little integration of long-term cancer risk into public messaging. Pediatricians may not be trained to link early weight gain with future malignancies, and most cancer screening guidelines don't address early life metabolic history. The result is a dangerous disconnect, one in which a major risk factor is widely recognized, yet rarely framed in oncologic terms. Parents, educators, and health systems must confront this reality. Preventing cancer in adulthood increasingly depends on protecting children from the hormonal and metabolic imprints of obesity. This requires more than just dietary advice or physical education programs. It calls for systemic changes in food access, urban planning, school policy, and pediatric healthcare training, changes that recognize obesity as a lifelong cancer risk factor, not just a childhood inconvenience. If childhood obesity continues on its current trajectory, today's youth will face not only a shorter life expectancy, but a dramatically higher burden of aggressive, early-onset cancer. This is not speculation. It is a predictable outcome of the biological conditions we are allowing to form now. The warning signs are already here, in rising cancer rates among young adults and worsening survival gaps tied to obesity. Ignoring the cancer implications of pediatric obesity is no longer an option. The time to act is not when these children become sick adults. It is now, while there is still time to alter their trajectories. Every pound prevented in childhood may mean a tumor that never forms in adulthood. That is the true cost and potential of this pediatric alarm.